Seniors, stop right there. Before you open your refrigerator and reach for your medications, you need to hear this. What if I told you that putting certain medications in the fridge could quietly turn them from life-saving helpers into something dangerous, even poisonous? It may sound shocking, but every year, thousands of older adults are hospitalized because they stored their medications the wrong way. That includes simple mistakes, like thinking the fridge is the safest place for your pills. It's not always true. In fact, for 5 common medications, refrigeration can ruin the medicine, weaken it, or even cause it to harm your body. But don't worry, you're not alone in making this mistake. That's why this video is so important. So make sure you watch all the way to the end, because we'll also share 4 medications that absolutely must be refrigerated, and getting this right could save your life or the life of someone you love. Let's start with a disturbing fact. According to a 2023 study by the Institute for Safe Medication Practices, seniors over 60 who improperly store medications, including putting them in the fridge when they shouldn't, are 44% more likely to experience medication failure. That means the drugs don't work the way they should. Imagine taking something you trust every single day, only to discover too late that it hasn't been helping you at all. Or worse, it's been slowly making things worse. And the scariest part, you probably wouldn't even know it. Many medications don't change in color, taste, or smell when they go bad. The only sign might be your health slowly declining. That's why proper storage is so critical. Let's begin with medication number 5, antibiotic tablets and capsules. Almost all of us have taken antibiotics, maybe after a dental surgery, a bad cold, or a stubborn infection. Some liquid antibiotics do need refrigeration, but most antibiotic pills do not. And yet, many people think it's safer to pop them into the fridge. Here's the problem. Every time you open and close your fridge, moisture and temperature changes happen inside. That moisture can break down the outer layer of the pill, which protects the active ingredient inside. Once that layer breaks down, the medicine can clump, lose strength, or form harmful byproducts. Some of these byproducts can irritate your stomach or even cause allergic reactions. For example, common antibiotics like amoxicillin and doxycycline are highly sensitive to cold and wet conditions. Once the active ingredient breaks down, it won't fight infections the way it's supposed to. Worse, it may allow bacteria in your body to grow stronger and resist treatment. Moving on to medication number 4, oral diabetes medications like metformin or glipizide. These are crucial for many seniors managing type 2 diabetes. But what many don't know is that these pills are carefully designed to stay stable at room temperature. When you put them in the fridge, the cold air and moisture can slowly destroy the medication's structure. Metformin, for example, can soak up moisture from the air, turning it gritty, discolored, and less effective. If you've ever noticed your blood sugar creeping up for no reason, your fridge could be the culprit. Even though your pills might still look okay, the medicine inside may no longer work properly. That means blurred vision, constant thirst, fatigue, or even serious complications like diabetic shock. Number 3 is nitroglycerin tablets. These are often given to people with angina, which is a warning sign of a potential heart attack. Nitroglycerin works fast to open up blood vessels and allow more oxygen to reach the heart. It's one of the most powerful medications you can take in an emergency, but it's also one of the most fragile. Cold temperatures and moisture from a fridge can destroy nitroglycerin almost instantly. The pill may dissolve, crumble or melt in your hand, and even if it looks fine, it may not work when you need it most. Doctors say that nitroglycerin must be stored in its original, tightly sealed bottle at room temperature, away from light, moisture and heat. Keeping it in the fridge could mean the difference between life and death in a true emergency. Number 2 on the list is aspirin and other salicylates. Aspirin is one of the oldest and most trusted medications used to relieve pain, reduce fever, and lower the risk of heart attacks and strokes. Because it's so common, many people think it's safe to store anywhere. But aspirin is very sensitive to moisture. In the refrigerator, condensation forms every time the door is opened. This can lead aspirin to break down into acetic acid, which smells like vinegar, and salicylic acid, which can irritate your stomach. Even worse, the breakdown can cause the pill to lose its effectiveness and create harmful compounds. If your aspirin smells funny, is clumped together, or looks odd, throw it out immediately. Always store it in a dry, cool drawer away from the fridge and bathroom. Now, here's the most dangerous medication you should never refrigerate: warfarin. This blood thinner is used to prevent blood clots that can lead to strokes or heart attacks. But warfarin is incredibly sensitive to both temperature and moisture. Even slight changes can affect the dose your body receives. Too much can cause dangerous bleeding. Too little can lead to clots. And the worst part, you may not notice anything until it's too late. Some seniors have ended up in the hospital because their warfarin stopped working due to improper storage. It should always be kept at room temperature, in a sealed container, and far away from any source of moisture, including the fridge. Now that we've gone through the 5 medications that should never be refrigerated, let's switch gears and talk about 4 that absolutely must be kept cold to stay safe and effective. Number 4 is insulin. This life-saving hormone must be refrigerated until opened. Once opened, most types of insulin can be kept at room temperature for up to 28 days, but always follow your pharmacist's instructions. If insulin gets too warm, the proteins break down and it becomes useless. On the other hand, freezing it can destroy it completely. So, store unopened insulin in the fridge, but never in the freezer, and don't let it sit out too long once you've started using it. Number 3 is liquid antibiotics, especially those given to children or seniors who can't swallow pills. When your pharmacist mixes powder with water to make these antibiotics, they become unstable and begin to break down quickly at room temperature. That's why they always come with a warning to refrigerate them immediately. Leaving them out, even for a few hours, can reduce their strength and allow bacteria to survive the treatment. Number 2 is a group of newer medications called biologic drugs. These include treatments for arthritis, Crohn's disease, psoriasis, and even some cancers. Biologics are made from living cells and must be refrigerated at all times. If they're exposed to warm air, the proteins inside lose their shape and stop working. You may not notice right away, but over time your symptoms may come back or worsen because the drug is no longer helping your body. Finally, number 1 on the list of medications that must be refrigerated includes certain eye drops and injectable medications. A good example is latanoprost, used to treat glaucoma. If not stored properly in the fridge, it loses its ability to lower eye pressure and protect your vision. Some injectable medications like vaccines and epinephrine also need to be stored cold to work. Even short periods at the wrong temperature can make them ineffective. So now that you know the truth about these medications, take a moment today to check your medicine cabinet and your fridge. Are you storing everything correctly? Do you have pills sitting in a cold, damp place that should be in a dry drawer instead? Or maybe you've left something out that needs to be chilled. These small storage mistakes can have serious consequences. If you're a caregiver for a senior loved one, this is especially important. Make sure they understand which medications need to stay cold and which ones absolutely do not. You can even write labels or set reminders to help keep everything in the right place. Talk to your pharmacist if you're unsure. They can explain how each medication should be stored, and they might even recommend special containers to help you keep everything safe. And remember, just because a pill looks fine doesn't mean it is. Medications can degrade without showing any signs. That's why proper storage is the best way to protect your health. Have you ever made a mistake with medication storage? Did it cause any problems? Share your experience in the comments. Your story might help someone else avoid a serious mistake. And if you found this information helpful, don't forget to share it with friends and family. Because when it comes to health, a little knowledge can go a very long way.